Hi, this video is the demonstration of the FUE donor scar. We harvest mostly around here, roughly around 1,200 hair graft and scatter in the middle. And this is around 5 years follow-up. And I try to provide as many example of the FUE and FUT donor scar as much as I can to help educate the viewer of the different form of surgery, the FUE versus the FUT. And this is the FUE example. FUE means shaving the back, pluck one at a time. It leaves you tiny dots of scar and allow you to shave your head shorter. The FUT is more invasive because we had to cut out the strip and close you down, stitches you up, result to a linear scar. Both techniques have the pro and con. The pro of the FUE are less visible scar. We're not cutting you open. That means less invasive than the FUT, less painful, less bleeding, less chance of infection, faster recovery. But the downside of the FUE are, number one, we had more aggressive shaving. We had to shave all the back, where the FUT we want to shave a small area. The FUT, when you walk out, the long hair should hide the scar, where the FUE, it would take around 2 to 4 weeks for the back to look better. Again, it will take many months for perfect. The other downside of the FUE is not more aggressive, is more more expensive. Why? Because it's more labor. The other downside of the than the FUT is cheaper. And the other downside of the FUE is we can only harvest a small amount of graft. So around 2,250 up to 3,000 graft max. But the average around 2,000, 2,250 with good quality graft. And thus the FUE is more for mild to moderate hair loss. On the other hand, the FUT can harvest from 3,500 to 6,000. The FUT more for advanced hair loss pattern. And the FUE can be used for advanced, but you're going to need multiple sessions. So sometimes that's not very popular for advanced hair loss patient. And then the growth rate now, you can have excellent density with my work, whether you do FUE or FUT. But if you compare my FUE to my FUT, it's around 10%, 5-10% or up to 20% less dense than the FUT. But if you use my FUE compared to other clinic, whether they do FUE or FUT, my FUE still have better density. So on the other hand, the FUT, the benefit is less shaving, it's cheaper because it's less labor, and it's cheaper doesn't mean less quality. As a matter of fact, the FUT has more density than the FUE, only from 5 to 10% average, but sometimes it could be 20%. And the FUT is more for advanced hair loss, class 5, 6, or 7 hair loss. And those are all great about the FUT, but the downside of the FUT is less is a linear scar. It's harder to wear your hair short because the scar can be visible. The FUT is a little bit more invasive, but again, both FUE and FUT are minimally invasive. That's why we do outpatient. You go home. You're gonna have some numbness along the linear scar, and pretty much this is a little bit more painful, but then they both are very manageable with pain medicine. So this is the demonstration of the FUE donor scar. And if you'd like to more detail about that, go to my YouTube channel, click on playlist, and then there's a playlist for FUT scar and then a playlist for FUE scar, and you can watch as many as you can. Again, result vary from one individual to another, and I perform both FUE and FUT. Both FUE and FUT create scar. There's no surgery without scar, but the FUE scar is a little bit less visible. So this is the demonstration of the FUE donor scar. Thank you.